Some people don't like to have things injected into their skin. For those people, here at Agno Aesthetics Clinic, we use microneedling, or medical needling as it's known. Hello there, how are you today? All right?
I'm fine, thank you. As a teenager, I suffered from severe acne and finally got rid of it, the acne itself, but I was left with horrid pockmarks, which used to make me feel a little bit self-conscious. So I met a friend who had a similar problem, and she told me that to go to Qualidental, and they could help.
Thank you. Can I take a seat?
Oh, here we go.
Right. The patient we're going to be treating today is complaining of acne scarring on the skin, which is a complaint that a lot of men and women have. And of course, the treatment is equally effective on both.
Yeah,
coming along nicely.
Yeah.
I think with all the treatments that should be really nice. We should get a really good result. Fantastic. Right now, Nicola's going to get you ready. She's going to put some Emla cream on you to get it all nice and numb. Okay? So make it
the process involves anesthetizing the surface of the skin with a lot of Emla cream, which goes on for about 40 minutes before the actual procedure takes place.
It is actually a restorative process.
I'm just adding the influence of a woman's wishes.
I was told that it would hurt a little bit, but the benefits would be huge. So not that I'm going to end up with 20-year-old skin, I know that, but they've told me that it would hurt a little bit, so they put some numbing cream on.
Once the skin is nice and numb, we make sure it's very clean, free of any bacteria. So we use a chlorhexidine wash to make sure that is the case. Medical needling is a process where we use a roller with micro needles in it, about 1 millimeter in length, which we use to scarify the skin and induce the production of collagen and elastin by the person themselves. We start the process of rolling the micro needles across the skin in all sorts of different directions. We try to do it in 4 different directions at least, and that creates a slight micro bleeding of the area, which is an indication that we're causing the micro trauma that is required for the process of collagen production to commence.
Okay.
Today is only the second treatment, and Tony expects me to have about 6, and everything he said is happening, you know, so I'm quite happy with the process as it is.
Once we finish the procedure, we clean the skin of any blood remnants and everything else with some sterile gauze dipped in saline solution. And all you see from the trauma that we've caused is a redness which is reminiscent of mild sunburn. This redness should go within the next 24 hours. Now that we've scarified the skin and we've got pores all over it, it's a good idea to apply some oil very rich in vitamin E, which will actually feed the skin and will help the process of collagen production begin.
What's that? Is that the vitamin A or?
It's the vitamin E, the Environ vitamin E,
Oh, vitamin
the high
E.
potency. We want this to feed the skin.
Now that we've finished the procedure and we've got a nice red glow on the face, my colleague will apply the General Del Pure Mineral makeup on it to give the patient a natural look when they go out to continue their life.
After having such a treatment, which it felt quite painful at, you know, when I went all red as if I was sunburned, this is the end result. I've got, you know, I can carry on my day, go to work, and nobody will know the difference that I've had any treatment at all. People say I look really well, a little bit younger than my age, which is always nice to hear. It's given me a satisfaction and a confidence that I can talk to people face to face rather than look away or, you know, try and hide my face. It's brilliant. Can't you see the results? I can.